Hello, Malaysian clinical psychology students. I am Dr. Alvin Ng, as you would probably know me already here and there. And with me today is Dr. Debbie Joffe Ellis, wife of the late Dr. Albert Ellis, the originator of Rational Emotive Behavior Therapy. Well, there you go. And she's going to be talking with us a bit about what REBT is about as an introduction, and so that we can have further discussions about REBT in class. So, Dr. Joffe Ellis, would you do the honors?
Oh, it would be my pleasure. Hello, everyone. I'm delighted that Dr. Alvin invited me to say a few words to you, and I am so delighted that he is presenting on Rational Emotive Behavior Therapy to you, because in my view and the view of many other people, not only is it the pioneering cognitive approach that heralded in the cognitive revolution in psychotherapy, but it is the most holistic of all the cognitive approaches. Not only is it scientific, evidence-based, complete with a thorough, brilliant theory and many tools and techniques, but it's also imbued with compassion and emphasizes the importance of unconditional acceptance in three main forms: unconditional self-acceptance, unconditional other acceptance, and unconditional life acceptance. Plus, from the get-go, REBT emphasized the importance of gratitude, daily gratitude. And just fast forwarding to the 21st century, and the Journal of the American Medical Association has published articles on the positive impact of daily gratitude on the physical well-being of the body, particularly the cardiovascular system, but I digress. So my late husband, Dr. Albert Ellis, brought out REBT in the early 50s. Dr. Aaron Beck, who's known as the father of cognitive behavior therapy, consulted with my late husband whilst Dr. Beck was doing his research on depression, and has given credit to Albert Ellis for his influence and help. And of course, CBT came out more than 15 years after REBT. Due to the superb, excellent and huge body of research CBT has done and is doing, and since my husband's passing, REBT seems to be becoming marginalized. And it's my goal and my mission and passion to keep it alive and equally in the forefront, not because he was my husband, but because it has its unique qualities that are not seen in CBT. And it is holistic, and there's room for a multitude of effective therapies. And so again, my appreciation and delight that such a brilliant and witty and remarkable professor as Dr. Alvin is bringing REBT not only to you students, oh look, he's blushing, but has invited me to speak at conferences. In many ways, and quite seriously and sincerely, Dr. Alvin is playing a very significant role in bringing modern psychotherapy to Malaysia, and that spills over into other Asian countries as well. So I don't know if I've gone on a bit too far, but the effectiveness, the humanism, the humor, the down-to-earth nature of REBT. And the final thing I'll say on this kind of monologue before Dr. Alvin might ask me anything else, if he does, if we're not already next month, is that humanity has gone through a very tough time in the past year with COVID. But it's not the first time that humans, either on a small scale or broad scale, have had to deal with difficult happenings. And REBT is not just the effective scientific, humanistic, holistic approach, which it is. It's also a way of life for those people who choose to apply it as such. And therefore it has the tools. One doesn't need to seek therapy necessarily, or even be an academic student to understand the simple common sense wisdom and tools that REBT succinctly provides, such as how to not catastrophize and orphalize, how to keep things in perspective. It teaches us not just to replace a negative thought with a positive one, but to eradicate the negative thoughts so we don't repeat a habit of going there regularly, and our default go-to becomes more realistically optimistic ways of thinking. So anyway, I'll take a breath and see if Dr. Alvin has any other questions for me.
Thank you so much, Dr. Joffe Ellis. And I must say, I think you'll be pleased to know that recently in Malaysia, we have been getting more REBT research done. And one particular one that I can remember, I just read about it a couple of days ago, is there's this intervention at schools on how we can teach children REBT approaches to how they can cope with difficulties, and it seemed to have gone well. So I really hope to see more of these kinds of research around, and for Malaysia to benefit. And well, this is one of the reasons why, you know, I really would like to promote REBT, and hopefully we can have more discussion, students, after this, and see where we go. And hopefully you'll also take this opportunity, being postgraduate students, to run research into the efficacy of REBT in Malaysia. I'm very confident that it's going to be very efficacious, very efficient, because of like what Dr. Joffe Ellis just said. It's very holistic. It involves basically the person and the whole community, and how we can all live together. Yeah, personally myself, when I first heard and learned REBT during my training days, it just struck me like, hey, this is the thing. This is awesome, which is why I'm just so happy to even be talking about REBT. So yes, thank you for that teaser. I think let's not have too much, because otherwise I'll have to start paying you lots of money. So yes, that means thank you so much for being so generous with your time. You know, I really am very, very grateful, and I'll continue to be super grateful. And to grow that gratitude of this moment, just a few minutes. It's been such great time talking to you, Dr. Joffe Ellis. And
It's such a pleasure. It's a pleasure, and thank you and congratulations on the work that you do. It's superb.
thank you. And we'll look forward to having more of you at workshops in the future.
I look forward to that too. You know, in workshops, I do live demonstrations, and people, my students or attendees of the workshops have given me the feedback that as much as they like hearing about the theory and all, but to see it in action, and I don't do role play. I ask for a courageous volunteer, or more than one, depending on the time. Okay, you're it. Who's willing to bring up a real issue. And I haven't yet had an experience in my years of doing this that hasn't in some way been a valuable teaching experience and a valuable learning experience. And in a number of those situations, it's proven to be life transforming in just a few minutes.
Oh, I totally agree. I've seen it happen in front of my own eyes, and it doesn't just impact the person in the role play, it impacts the rest of us watching and go, wow.
Yeah, really.
Yeah.
So I look forward to doing that in Malaysia.
Thank you. Thank you so much, Dr. Joffe Ellis. And all right, it's a wrap.
It's a wrap.
Thank you.